Okay. Okay, here we are, preventive care grand rounds, and we are going to talk about our experience in Hong Kong. And then this happened in the year 2001 to 2007. So we still have some connections with Hong Kong that I will mention during the session. I just want to mention, I didn't include the slide, but when Abel presented his experience in Africa, I asked him to announce that we are completing 50 years of the program. So I just want to reinforce that. Now we have for sure a confirmation that the program is started in 1972, the same year that I started the medical school, my medical school, so in Brazil, and that's something interesting. And then this program, the first graduate were in 1974, and we are gonna do the celebrations in the fall because it was the fall of 1972 that the program started. So just be aware that we are gonna communicate with you about the celebrations of 50 years of the preventive care program that is started with a health science program. Okay, let's go to Hong Kong now. So Hong Kong is a very beautiful city full of contrasts, and this is one of them. You have a lot of skyscrapers, and then you have a lot of nature at the same time in the city. And then the night you can go to the other side of Hong Kong and you have this festival of lights, especially during the summertime, during the Christmas time. Very beautiful. Well, when I arrived there, I mean, the first impression about my mission was that they also have a problem similar to what we have by the influence of Western type of diet. And you see on the left side here, this big M is the thing that call attention. And still today, when you go there, you can see sometimes from one McDonald's, you can see the other McDonald's in the corner there. So just to show how much influence they are by this. This was a report on the, I think it was in the Recorder here in California that they announced our departure to Hong Kong in 2001, and then we arrived there in 2000. I mean, this picture is in 2002, but we arrived there in the beginning of 2001. So what we did there during this period, I went there based on the Adventist, the General Conference of Seventh-day Adventists. So I was employee for the division, the American division of the Adventist Church. So I work as a health education specialist, preventive care specialist, and then I had to have the CPR instructor. I will show you on that. So I work for the 2 hospitals, and we have the lifestyle management center, was not department. And then we did all of these activities, and I will show some of them there. In addition to that, I found, I mean, some other missions. So I was also an adjunct teacher at the Hong Kong College, Hong Kong Adventist College in Clearwater Bay. I didn't teach much on that. It was a few times a year that we have the special lecture that they asked us to do. Then I went to this Bible auditorium that is in Kowloon City, that is on the other side of Hong Kong. Hong Kong started in an island, and Kowloon was in the new territories. And we had there we have lectures. I mean, every month mostly we have seminars there or health fairs or both. We have a newsletter. We went to restaurants in the city. We went to the Rotary clubs. We produce some of the stuff. We have some videos, and I'm gonna share all of these things to you. And also I was the director of health for our church there. Hong Kong Adventist Hospital and Chihuahua Adventist Hospital was the two hospitals were founded or built by this guy, Dr. Harry Miller. If you wanna know a little more about that, you can read the book China, the China Doctor. Very interesting guy. And he was the one that when he came to Hong Kong, there was a little bit of malnourishment, and then he designed a kind of a soy milk machine that helped many of those kids to improve their nutrition. So we did, for me to go there, I need to have an advanced CPR course and then to teach. So I was credentialed to teach not only people in the community, but I was going to teach other trainers. So I was training the trainers. So I had to do a certification on to be able to teach people to do CPR courses. And then we demonstrate, and this was Charlene Show, Showpack, one of my assistants there. So one of the first things that we have, it was the fitness club or running club. Hong Kong is all into running marathons there. And we have one of the first, Bill might know that, we have an audience, Bill Bill Andres, sorry, and Bill will confirm or not, because I believe it was the first running club in the city. Now we have tons of other running clubs, and Hong Kong has several running events, and the Standard Chartered Marathon is one of them. So this is a picture of our running club in 2006. So we have a good group, a mix of Chinese and expatriates or people from other countries that live in the city. Hong Kong, again, is a city of contrast. So we have Westernized there, Western, we have Chinese, we have all races represented there. So this is one of the marathons that I run. I run 5 half marathons. I never run a marathon. I believe a marathon was too much for me. And it was fun. Another thing that we promote in the city, based on the idea of lifestyle, this is a smoking cessation. We used to have there the Quit Now program. And one of the essentials is this guy in the middle here. He is, I'm not sure if you can see here. He is using a kind of carrot stick instead of smoking, just for fun. Here is one of our smoking cessation. We went to a prison and we did smoking cessation, not for the prisoners, but for the guardians, for the officers that work in the area, and we helped them to stop smoking on that time. Also, we went to schools. I mean, one of the main focus is trying to influence children for good behavior. So we did a week of health in Macau. Macau is very close to Hong Kong, and then this is a picture with the kids there. We did another one in Happy Valley. This is in the very close to the hospital. Again, we designed those programs for helping or motivating them to a good lifestyle. I've been to tons of other schools, public schools and other private schools, and give lectures for them. I remember one time I have to I was going to talk about diabetes, so I asked the guys to give me some sunglasses and a cane, and I entered in the lecture like I was blind, and just to motivate them to see that diabetes is not a joke. 10% of the population in Hong Kong are diabetics, and so we need to push a little more to influence these guys to for a good diet and good and keep doing exercise. And also they have, I mean, most of the fruits there are imported, but they have a variety of vegetables and fruits that is accessible in general. So here is a picture of that. By the way, this lady here is my wife, but don't tell her that I put her in the movie here. And then we went to corporations. So another part that is important when you go and promote health is to promote health in places that you have a captive audience, and that's what happened to this place. We went to Tricor, Cathay Pacific, Merrill Lynch, 3M Hong Kong, Shangri-La Hotel, Jones LaSalle, Life Cafe restaurant. In Life Cafe, I used to go there, I mean, once a month and do a lecture in the evening for the members there, that for the guys that went to eat there. It's a vegetarian restaurant. And then we went also to the Taoist temple. And in 2003, we went to this Metropole Hotel. That was the beginning of SARS. And then we have been done lectures in this hotel before, but the last minute, we have the SARS epidemic. It started in that hotel, and then we canceled it. Fortunately, we were not there when the guys came from China with the SARS virus, and it spread to the whole city and the whole world. And in Hong Kong, about, I believe, 300 people died. So this is a lecture that we did for the managers for Shangri-La Hotel Group. And this was good because we made this connection with them. And then later on, the Hong Kong Adventist Hospital continued to maintain a connection with them and giving some nutrition consultation with them. So consulting with them. Our director of nutrition, that is also a graduate from Loma Linda, Wing Wong, he continued the contact with Shangri-La Group. This was one that we did health fair at the Cathay Pacific airline. So that was very exciting. So it was not inside of a plane, but they have the walls look like a plane. And we were dressed as flight attendants, aren't we? Well, this is our program that was traditional there, the FunFit weight management program. So that's one thing that we run for many years there. So we have the program. Everyone has an individual assessment, and then they have individual meetings with the dietitian, with the doctor, and then with the health educators, and then they have the camps. They have to come on Sundays to our school in Clearwater Bay, and then we run a kind of a camp just during one day. Here is one of the group, and then here is after they are motivated for it. And then we run a lot of vegetarian cooking classes, both in Hong Kong Adventist Hospital and Chingwan Adventist Hospital. This is a cooking demonstration that we did together with a birthday. This is just for employees mostly in Chingwan Adventist Hospital. And sometimes I would go there and prepare some dishes and try to do my influence on the cooking class. But most of the time, we have people that are more experts on that. And then this lady that is recording there on the left side here it was a dietitian, Helena, and she was a dietitian from the Chingwan Adventist Hospital. And one time we offer a vegetarian cooking certificate for the participants, and this is what we did after they attended 10 sessions of our cooking classes. We have a program that is called New Start. We borrowed that from WIMAR, and we run the program mostly with a health trip. That means that we would go to Taiwan or Thailand or China. This group is from China. And then we would go there and run a 1 week session talking about diet, exercise, but with other activities like we also did a health it's a health tour. We would visit some places for fun, and then we have the lectures in the afternoon. So a mix of tourism and health. So this is the visit that we did in Thailand. In Thailand, we go 2 hours north of Bangkok when we have a school there in a center called Mission Health Center. This one is in Taiwan. We have the Taiwan Adventist College, and they have a center that is able to accommodate. It has 100 beds, 100 bedrooms there for people to do those things. And also we have some accidents in the way. This was a joke, okay? Nobody fell down. We just found this lady in Thailand on the side of the water. We didn't know what she was doing there. But this is another trip we did with our participants in China. We went to cities that are close to Hong Kong, not very far, like Zhuhai and Shenzhen and Dongguan. So they have a lot of new hotels and resorts that offer good prices for us to do these trips locally or close to Hong Kong. This is, I think this is in Dongguan, if I'm not wrong. This is my team, Aaron Liu, Jacqueline, and Becky. Becky, on my side, she came later after I came back. She came to Loma Linda and finished her master in public health in nutrition here in our school. We went to St. Jane one time and we saw these guys serving tea with these weird pots there. So if you see, they have to go backwards and then they fill up the cups with tea. Was interesting, was something interesting. It's a good exercise though, huh? This is my team. Becky, as I mentioned, came here. And then Cindy was a nurse. Jacqueline was, the first Jacqueline on the left was an exercise trainer. And then Jacqueline was the main assistant, and Rosita was a student that she graduated from our health school in Clearwater Bay, in our school there. She did a program there and then came to work with us. We went to estate health. In Hong Kong, they have a lot of condominiums. People live in those buildings, and they have a way to have a space for activities. And we went to those places several times to promote our programs there, to promote health activities. This is a list of places that we went. Here is one example of what we did. So we went there, we have a talk, and we have some activities in terms of exercise on this, or we have a health fair where we check for blood glucose and cholesterol and blood pressure, and similar to what we do here. But here we are not doing more blood pressure, blood tests. At least in Dresden, we don't do that. Then we went to Bible Auditorium in Kowloon. It's one of the biggest cities in Hong Kong, and this is the team that we form with them. Some of these guys here work in the hospital, and some of them are members of the church. The lady on the left, she was 104 years old. She used to be a journalist in the time of the struggles in China, and then she moved to Hong Kong. But she was with us, and I remember one time I was there promoting the services and having people to do assessments with me. And she came. She wants to be also being asking me some question about health. And then she came to my office, and then she asked a few questions, and then I told her, I need to ask you questions. How you got to 104 years old? And then she laughed a lot, and she said, no, I have some problems. You have to help me. And it was funny because with that age, I mean, who would not have problems? And one of the issues that we did when we did stress management was this representation of the 4 personalities. And then I would bring my hat, and this guy will sit in my hat, and then I will react even as a sanguine, and then I'm very irritated, or a passive, I would not do anything, or a humorous person, and then I will laugh with the guy, and then representing the 4, at least 4 personalities we will have on that, and we had good time with that, and sometimes people laugh and understand what we are trying to do, and different personalities, and was something that we tried to do the lectures a little bit out of just speaking without having any application. So this was one lecture that I brought. I don't remember what kind of recipe I was doing, but I remember that I was eating a banana. And after that, my goodness, one of the assistants there, one of the attendants wrote my picture there. Dr. Dos Santos, garlic, banana, exercise, sleep well. And that was my fame in the city. I also wrote a script for our Sesame Street puppets. And then before we have a seminar, we got the young folks there, and then they translate this to Cantonese, because most of my lectures were in English, and I work with a translator. But for this case, I just write the script for the lecture. So if we are talking about like diabetes, So we have a script for diabetes, what causes diabetes and what is the best thing to overcome diabetes. And when we put this for these girls to represent there and to talk there, and they translate to Cantonese, and was fun. It was fun. The young people were involved, and also the audience liked to have the introduction of the seminars with Elmo. This was my farewell when we finished in 2007, and so they invited us to go to a vegetarian restaurant, and this lady in the front here is always with us. When I came back there in 2015, she took me to the restaurant again with a group of the church, and then she said, every time you come to Hong Kong, I'll take you to have dinner with us, because we are very thankful for what you did here. One time we have a stress management week. We did in Chim Cha Tsoi, new territories. This was done by the conference, and I was the main speaker, and we share some. I used to do a health talk, and then Pastor Kong, that was the pastor for the Adventist church there in Bible auditorium. He would finalize with a spiritual topic. So we working in a double message, one that was health and then one that was spiritual. We worked very well. In his church, we used to have sometimes 300 people in the church. Just for you to have an idea, sometimes in the morning, on Saturday morning, we have 50 people in the church. And then in the afternoon, during the seminar, we have 300. So it was something. This is an example of a lecture. So as I told you, I will speak in English, and I always have a translator. This one was about garlic, so that's why you know that the guy was mentioning about banana, garlic, lifestyle. So this is another one that we have. Most of the time we have lectures that are translated, because we might have someone in the audience that only speak English also. So we have to do this bilingual. This one you know for sure. Yeah. Dinner should be the meal for a homeless person, and then lunch for a prince, and then breakfast should be a king. This is a picture of our health newsletter. It's called Total Health. We put one of the articles where are you killing your children? So to call the attention there. And then the one on the right was about Hulda Cruz, that we mentioned about her, and we mentioned about the blue zones and share with them the message that we have for health and longevity. We also create a series of health sessions for China. These sessions would be translated directly to Cantonese, and then they would put a voice for Mandarin, and then they share with the Chinese Union for the whole China. I don't know how much they use that, but they have the Hope channel in Chinese, and they use these sessions them. We recorded this in the Chinese Union Mission, and was interesting to do that. Was a good experience. We also made the exercise video that we prepared with them in the Chinese Union Media Center. And we did another one for the community in our work that we did with the Chunwan District Council project that we are promoting we are promoting these pedometers for them to use. And so we were able to distribute, I don't know, 500 pedometers and helping them to promote, to have more exercise, to walk more. So this is my one picture of my three assistants, Cindy, Jacqueline, and what is the name of the other one? I forgot. We went also in the high circles and we present a little bit of our research on lifestyle and blood lipids during this first Asian preventive cardiology in one of the universities there. Basically, we present these results of our new Start health trip, and we select 21 participants, and during 1 week, and then we with a healthy diet, vegetarian diet, and then activities that they have, and then we were able to show decrease in cholesterol, LDL, triglycerids, and even, well, we have a little bit decrease on HDL. And but in general, this was a good result, and we are able to share with them. We also went to the International Conference of Preventive Medicine. This was in Taipei, in Taiwan Adventist Hospital. So we represent the Hong Kong Adventist Hospital there and present our results from our few studies. We did a few surveys also there in Hong Kong, and we did also a hypertension study. So I was always involved with some of those research, not as much as I'm doing here now, but I was always interested to show numbers there. We present also during the 100 years of the Hong Kong Baptist University. This is Frank. Frank was a good friend, and then he asked me to present our studies also in their conference during these 100 years. So I present the results of the New Start program. And later on, we published, this was kind of a little more current. I'm still working with some people there, Becky and Peter Chuck, and we published one article on the effects of a vegetarian diet on disease outcome and medical visits. So we found that being vegetarian, you have less visits to the provider, meaning that probably vegetarian was a marker of a lifestyle. And then once if you are vegetarian, most likely you take care of your health, and you don't need to go to the doctor more as frequent as if you don't. This is a community. This is the same place that we promote the pedometers, and so we work with a group. This guy in the center here, Yu Chung Wong, this was the director of the hospital. And we have an American visitor from the General Conference on that time, as John McGee, so became a good friend. And this guy, Aaron Liu here, is my friend every time. So he was not directly working with me, but working for me, but he was always supportive of our activities. So we always did New Start trips together. We always did this community trips together. And so he was very supportive, and we are friends until now. He is retired there, but sometimes we keep in touch by WhatsApp, and so this is they gave us a recognition of the work done for the community for the pedometers intervention. They gave me a recognition for 5 years of faithful service. But I want to mention this. I never learned the Cantonese, but I never stopped studying it. For the 6 years that I stayed there, I always was taking classes and learning things. So the good thing is that once you do that, you learn. If I stay a little longer there, maybe I will learn how to speak because I was picking up very well. But even though I'm kind of old, I was there. After 40 years, it's not easy to learn a new language. But it's good when you do a lecture um, and then you can mention some words, and then they are very kind of. Excited that you are trying to do your best and you're trying to speak their language. And so if you go to any place, it's very good to learn even a few words like Cho San. Cho San means good morning. And then Lei Ho Ma, it's how are you? And then those things always make a difference once you want to communicate and share with them some help messages, but you kind of connect with them. I went to Rotary Club, so it's another thing that I went to. I would say I went to more than 30 Rotary Club meetings, and they invited me. One would invite, and on that time I have a lecture called "The Diet of the 21st Century." Somehow people like to know about the diet of the 21st century, and was nothing else than a plant-based diet. But somehow I visit most of the good restaurants in the city and good hotels for free on this time. And because I present a lecture, most of their meetings were done in those restaurants and hotels. And then we went there, and during lunchtime, we would eat, and then I would speak about the diet of the 21st century. Then this is a picture of the Hong Kong Adventist Church, Hong Kong Adventist Hospital Church. And I was the director of the health ministries of that church. The pastor here is Doug Martin. He was the pastor when I was there. And I am here in this corner here, if you see my wife here and myself. And we had the opportunity to sing also during the Christmas time. This is the Hong Kong Adventist Hospital Choir. And we sing for the church there, and that's we have fun there. I try to be as much Chinese as I could, but it's not easy. This is a picture that we took in the Peak. If you go to Hong Kong, you have to visit the Peak, and so they put our cartoons there. I mean, not very, not look like very me, but for the Chinese, they were the ones that draw that. All the Westerns, they look alike. So this is a card that I received from the Bible Auditorium when I finished my time there, and we became family, and we had a good time there. That's it. Mission Hong Kong accomplished. And this is a picture of one of the new buildings that is on the other side in New Territories, another tower that they built there. Okay, so let's stop share. It was a cool time, but my point here is that not only missions are like what Dr. Abel Alvarez did in Africa. So we are used to go to mission trips with a different point. In Hong Kong, we don't have this. We cannot do medical work there because they don't need medical work. They need health education. And I am trying to see if we can one day do a preventive care mission trip to a place that they don't need dentists and doctors to prescribe pills. And then they might need our services as preventive care specialists. And so that's one example of it. Any questions, any things to say? Anything else, Bill, that I missed there?
You know, Dr. Docent, oh, go ahead.
No, go ahead.
No, I always like to hear what we do on these outreaches for preventative health to these other countries. And I was looking at an interesting case study the other day, and they were having an overwhelming influx of people coming to the emergency room where it was way too many. And they were actually coming to the emergency room for as primary care because they just don't have anything else, or primary care is so far out there and just like everything's being inundated, it seems like, with people coming to emergency. And a lot of them were also people who had insurance who are coming back just regularly to the emergency room. So my question is this: as I was watching you doing the preventative health there, it seems that possibly they need public health as a buffer before they go to medical care. And then if they can't get fixed in public health, then they go to medical care. We're doing it backwards. They're going to medical care, getting hooked on medical care, and they can't get fixed. I think they need to come to preventative health first and then go medical care if they need medical care, because it's not sustainable. The medical care is not sustainable. I don't know, what do you think about that?
I think they are missing to have a kind of a professional like we are, preventive care specialists, and maybe health coaches. At least I went on one time to a university in Florida to do my health coach certificate, and then they were mentioning that what happened is that once they developed the health coach services, they were able to decrease the amount of people that would go to prevention, to emergency, and to the psychologists. And then they figured out that they could do a triage and then attend these guys at a health coach level, at a preventive level, and not too much on the other side and doing emergency room that is really very expensive for a hospital to run and for a corporation to run. So I believe it's a sign that they need more preventive service, would do a better job to prevent medical expenditures there. Thank you for the question, though. Bill.
Yes. For those of you who might not know me, I actually preceded Dr. Santos to Hong Kong and was working in the same capacity. At the time I was there, the internet was just coming into vogue. And so Dr. Santos was able to do a lot of additional things that we were not able to because of improved technology. But I appreciated your presentation. It brought back many good memories and even recognized many of the places and several of the people there. But yeah, in terms of challenges in Hong Kong, I think one of the challenges is that it's a very interesting place to do public health and to do research, because in terms of longevity, Hong Kong has one of the highest life expectancy rates in the world. It's actually higher than the US. At the same time, they have a huge problem with stress. For many people who live there in Hong Kong, it's a very stressful environment. Think of it as one of the most crowded places on earth. You have somewhere between 6.5 to 7 million people living in a total area the size of Rhode Island. And so it's a very high intense living type of society. But as Dr. De Santos pointed out, and this is one thing that many people are surprised by, most of Hong Kong is country park. And one of the conundrums that I found there is I really enjoyed going hiking on the hiking trails. There are quite a number of hiking trails in Hong Kong, and you get a real good workout on them. When people would come to visit me, I would take them to the usual tourist traps, and then I'd say, you want to see a side of Hong Kong that most people don't get to see? And we'd go places where there wasn't a single sign of civilization. And they couldn't believe that we were still in Hong Kong. But one thing that was very puzzling to me is that when I'd go out on these hiking trails, out of the 6.5 to 7 million people, in a 3 or 4 hour hike, I might run into 50 people. Did you have a similar experience, Dr. De Santos?
Yeah, we also, besides the running group, we started a hiking group, and we would go, we will have 15, 20 people, and we go to these hiking places there, and several times we meet a lot of people on the way also. I think that this was the British, that was the British's inheritance that they left. I mean, for every single place, they reserve a lot of green parts. I mean, I used to live in the Hong Kong Adventist hospital that was kind of in the middle of a lot of buildings. And then we have a pathway to a forest that we came from the hospital that will lead us to the city if we want, all in the middle of, in one side we have the big, huge, tall buildings, and the other side we have big trees and a forest. And then we could go to the beach, I mean, with the trails. And you will not believe that, but if we go there, I several times almost step on snakes on this thing. And one time we even faced a cobra. There's a cobra in the middle. The guys were scared. I mean, the cobra was there with with its head up, and this was in the middle of between the Hong Kong and Wan Chai in the walking that we have in what they call Bowen Road. Remember that, Bowen Road? Yeah, but as I mentioned, this city is a city of contrast. So we have these, we have the contrast with food. We have Western food together with Eastern foods. We have recipes that mix Chinese with Italian, with British, it's very interesting to go to those restaurants. And then I was looking now, I saw a list of 20 vegetarian restaurants in Hong Kong that were not there when I was there. So it's something that it pop out more and more and more and more nowadays in the city. It was a good work. I think it was an opportunity. I didn't know. I didn't expect what to do when I went there, and I said, okay, what am I going to do in this city, working in a hospital? One thing I was not able to do, and I still have something about that, and still I believe one day someone will be able to do. But as we have two hospitals, I wish we could have a system to visit the patients in the hospital. So, but we didn't. The doctors were too powerful there, and they kind of they own the patient in such a way that we cannot have a system to visit with them. But ideally, well, tell me about the United States. I mean, we try to do that in the medical center here, and we start visiting the smokers when we went to visit them with preventive care students. And when we start visiting the guys that were overweight, they cut the program. I mean, even the residents in preventive care are not in the medical center anymore. And so I don't know what's going on, but I believe it's money. Who is going to pay for the residents, and that's how it is. But somehow is a very good a challenge. One day I am planning to visit the Global Health Institute to see if there is a place in the world that we could go and then be able to visit the clients in a hospital and share with them some message for prevention instead of just they are in the hospital, and then we could share with them some of our things. It's just an idea, but I was not able to do that in Hong Kong.
Yeah, one thing I'd like to add is I've lived in several different countries. I've lived in several different states. And for me to get a vegetarian diet, a very healthy vegetarian diet, when I was eating out, I have never lived in a place where it was easier than in Hong Kong. Because Hong Kong has a great Buddhist influence. And there were a lot of very good vegetarian restaurants. But Dr. De Santos mentioned how food would come in to Hong Kong from many different countries. When I was there, about once a month, individuals from the apartment complex that we lived in would go down to the wholesale market where ships would unload their produce. And sometimes we would get produce in one trip from 7 or 8 different countries. And when it was in season, we could get oranges and grapefruit from Redlands. At the wholesale market, you would have to buy the produce by the crate. And so we would buy crates and then divvy it up back at the apartment among several families. But there would be stamped right on the boxes, Redlands, California.
That's interesting. That's interesting. I was always a consultant for our company, our food company. And then we used to have a food company like in Hong Kong that didn't have a factory, but we label all of the products with used to call Eden Synergy. And then we bought the foods from overseas, from China, and then we put a label, and then we commercialize this in the city. And we sold that. We have an office in Kowloon that we would sell this, but it didn't work very well for longer. When I went back in 2015, they didn't have the company anymore because it was, I don't want to speak badly, but it was run by the pastors, and the pastors didn't have much of experience in business on that time. And unfortunately, it was a little bit related to managing and business expertise. We also founded a New Start Center in Clearwater Bay. We started having sessions there, and this is still there today. When I was there, we built up that for new start, for programs for prevention in the school, in the clear water-based school. Okay, guys, any other questions? Because I think we still have time, but we talk of what we have planned for today. Okay.
Thank you, Dr. Dos Santos. Appreciate that sharing.
Yeah.
Okay.
Thank you.
Nice
Thank you
meeting you,
for
folks.
time. Yeah. Thank you.
Yeah,
For time.
I've always wanted to make it, and I says I'm gonna remind myself today, and I set my alarm. Okay.
Good.
Guys,
Good.
have a
Good.
good day.
Good.
All right.
Take care. Take
Bye-bye,
care.
All right.
everyone.
Bye.
Hey,
Nice meeting you. Nice meeting you guys.
that was
Bye.
interesting.
Yes, it was.